Morning. My name is Nicole Irwin. I'm the CEO of the American Red Cross of Idaho, Montana, and East Oregon. Here today to respectfully request that you vote no on House Bill 528. I understand that this bill is driven by the desire to expand patient choice, and we share that goal. Patients today already have the option to request directed and autologous donations. The link for how you do that was in our letter that we sent on Monday. But when it's medically indicated, this bill does not provide a meaningful choice. It is added burden for very little benefit. This law won't stop the rejections that have been talked about. If a physician rejects it, it's not safe. The Red Cross does not approve these. We will take the blood if there's a physician's order that it's medically necessary and that it is safe. This bill doesn't create new choice, it adds new cost and risk around a choice that already exists. The most important choice we can offer patients is to ensure the blood is actually on the shelf when they need it. Any blood, anytime, for any patient who demands it. And there are risks that are associated with this. When a close family member exchanges blood, it can make future organ transplant between them harder or impossible. When a man and a woman give blood to each other and later have a baby together, the mother's immune system can become primed against the father's blood type, which can cause her immune system to attack the baby's blood cells, causing serious anemia, jaundice, or even loss of the pregnancy. Right now, we are in a national blood shortage, and this bill would require hospitals to create and maintain more complex systems to test, track, store, and deliver special purpose units for autologous use, a pathway that supports very few people. The most important thing and powerful thing that the legislature and you can do at this time is to ensure that a safe, reliable community blood supply is available for every Idahoan. I respectfully ask that you use your considerable influence and public platforms to encourage more Idahoans to donate blood regularly by speaking to them in your communities, promoting drives in your district, reminding your constituents that donating blood saves lives. I respectfully urge you to vote no. Thank you for your time, your leadership, and your service to Idaho communities.
Representative Wheeler.
For question, Mr. Chairman.
Questions in order.
Thank you, Mr. Chairman. And Ms. Nicole, I apologize. Would you say your last name for me again?
Irwin.
Irwin. Okay, thank you, Ms. Irwin. Appreciate your commitment to this industry. I am wondering, first of all, if you could give me, and it's fine if it's only 3 or 4 examples, what are potential reasons for these rejections? I feel like nobody's been able to give me that answer yet.
Yeah. Mr. Chairman. Thank you for that question. So reasons would be obviously incompatible blood types. I think that there are reasons that there are reasons to do this also, we should say. There are people who have rare blood types and they can only kind of donate to themselves. So there are definitely medical reasons to do this. But up to the physician to find out the health of those donors. And we do know that the regular blood supply is safe. So a lot of different reasons, mostly having to do with health of donor and the appropriateness of that family member to donate to that individual or themselves. Another thing I would say is if you donate to yourself, you often need to do that pretty far in advance of your surgery. You want to replenish that blood loss. And so there are preservatives that are going to be in that blood to make it available for when you need it. And when you put a preservative into a blood product, it can increase inflammation, which can lead to infection.
Follow-up, or you?
Follow-up, if I could,
Follow-up,
Mr. Chairman. I'll try not to go to Furman levels of follow-up, but...
Okay, I appreciate that. Let you know he has his light on also.
Oh, good point. Ms. Nicole, could you speak to, and I appreciate the respectfulness of your testimony and your answer. I'm trying to avoid some potential impugning of your industry here. Could you just speak to me roughly about what is the profitability levels of the Red Cross in recent years?
Well, I think when you look at, are you talking about blood donations specifically, or our training services, or other things?
Let's talk about blood donation since that's the subject of this bill, yes.
Gotcha, okay. So we operate on a cost recovery basis. So what it takes for us to collect and to distribute, to store, test, all of those things. So we're cost recovery basis. And so there are times where the cost to deliver blood is much less or more than what it takes to deliver it. So yeah, there is some cost recovery to our fee structure.
Representative Erickson.
Thank you, Mr. Chairman. A quick question. If You mentioned in your testimony that it was an increase of cost, and I've noticed the fiscal note indicates there is no increase of cost. Can you
Yep.
speak to that increase of cost for everybody?
Ms. Sherrick Irwin.
Thank you. Yes, no, the cost often is passed on to the patient. What we understand is it's about double of the cost to that patient, and it does require special handling. So there is a need to cover that cost, and that is passed on to the patient. It's the double the cost of a regular unit, typically.
Representative Levitt.
Thank you, Mr. Chairman, for a question.
Yeah, questions in order. I'm trying to get all the questions out that maybe somebody will ask Representative Furman's question ahead of him.
All right. Thank you, Mr. Chairman. Thank you, Ms. Sherrick Irwin. Is that correct?
You got it.
Sorry. I was kind of wondering about, we heard earlier about testimony about a PDF file being removed for filing for this. Can you explain why that file was removed and now it's just general instructions?
Yeah, it's actually a website, so you can go to our website, and I can give you that link. And the process is that it's called Special Collections at redcross.org. And so you bring your order from your physician that it's safe, and then our Special Collections unit would contact you to schedule a time to make that donation, and then also make sure that we are arranging the shipment so that blood goes to the place that you need it.
Follow up?
Follow up?
Yeah, I was also wondering how many denials have happened in the state versus how many approvals have you seen for this type of collection?
It's a great
Ms. Sherrick
question.
Irwin,
Yeah. We don't deny this. That's been erroneous in testimony. This is all physicians. So I wouldn't know that because if we have a physician's order, we fill it. So I don't have access to that information because that is a physician-directed rejection.
Follow up, Mr. Chairman.
Follow up?
What about the approvals?
About 0.04% of the blood that we collect go for directed and autologous donations. And as I mentioned, there are sometimes medical reasons for absolutely doing those things. That blood type couldn't be found any other way. So it's about 0.04. It's not done very often. And I should say that when we do this, we do know through our hospital partnerships, much of that product is discarded and unused. So it kind of gives that false sense of security that you're having this patient choice because there's a good chance that that blood may not be used. It wasn't appropriate. It wasn't needed. And so that gift of life from a family member gets discarded.
One last follow-up, Mr. Chairman.
One more follow up.
You also mentioned that there's shortages nationwide. Can you comment on where those shortages are located? I mean, is it here in Idaho or is it worldwide that you're talking about with the shortages?
The shortage is in the U.S. Currently. And so we saw a surge of demand for blood in January. I think there were some maybe postponed surgeries, just different things. So we saw a surge, about 30% increase in the amount of blood that was needed. And so we are on what we call a blood appeal. We do that typically when there is less than a 3-day supply of blood in the country. And so since the blood banks are national, local to regional to national, it's a nationwide shortage right now, and it's severe.
Thank you.
Representative Furman.
Thank you, Mr. Chairman. If you want to go to Representative Kaler and save the best to last, I'm okay with that.
I was already saving the best to last.
Thank you, Mr. Rock Irwin. Can you walk me through to help me understand, like I'm a 10-year-old, what is the life cycle of donated blood?
Yeah.
And when somebody donates their own blood, how much can they donate in between? How does that store on the shelf? And can they actually, realistically use it prior to a typical surgery, say a knee replacement surgery or something of that sort?
Ms. Sherrick Irwin.
Yes. So the life cycle is you go in and you make an appointment or you stop into a blood center, and that appointment takes about 30 minutes. There's an extensive health history that you go through, and we make sure it's safe for you to donate. We're going to check your hemoglobin levels, your blood pressure, your pulse, all of those things. The donation takes about 30 to 45 minutes to collect, and then it goes through, we transport that blood to Salt Lake for processing. So we have volunteers actually that drive that blood to Salt Lake for testing, rigorous testing, and then that blood will start being available for use. You can donate to yours every 54 days. So you can do 1 unit, which is about a pint, every 54 days.
Follow up?
So if I was going to have a surgery that was going to require maybe 2 to 4 units of blood, and I can only donate my own blood, in this case, once every basically, 2 months, how long will that blood last on the shelf? Because it's going to take me, 4 to 6 months to collect enough blood for my surgery that's coming up. Is that reasonable for me to be able to do? You mentioned preservatives in blood. I mean, is this even a possibility?
It can be preserved for that long. Like I said, there will be a lot of additives in that. There will be, it'll be frozen. So I guess you could do 100 days prior. You could do 2 units, that kind of thing. It just, like I said, there's risks associated with that.
And
One more follow-up. We can drain you
One?
dry too,
Yeah.
if we need to. You.
oh, this is a bottomless pit, Mr. Chairman, of questions.
Yes.
So, what happens if there's complications in that surgery? I've signed paperwork. I want to use my own blood. I've done this. I've stored, 4 units. My surgery is going to take 2 units. I'm good, and we preserved it. But then something happens in that surgery, and I need 6 units, or I don't know. I don't know what the reasonable amount of units would be. But what happens then if I'm supposed to be using my own blood, but I don't have enough blood to use?
Mr. Irwin.
That's a likely scenario, and you would get blood from the general supply at that point. So just give you a scenario in Twin Falls, a woman gave birth to a baby and needed 88 units. We were bringing units in from all over the state and the region to sustain her life. So if we're not able to use your blood or you need more, you'll be transfused from the general supply to save your life.
And one last follow-up, Mr. Chairman, please. Please.
One more.
Thank you. Would this bill protect the doctors in the hospitals in that situation? Would that be? I mean, obviously, I'm under anesthesia, right? So I don't really know what's going on, and the doctors are having to make decisions. And I'm guessing this would be classified as emergency. In your opinion, would this bill protect the doctors in hospitals in that particular situation?
Mr. Irwin.
I'm not an attorney, but the gross negligence definition in this bill, I think, does provide that protection. But again, I'm a layman, so, yep.
Representative Kaler.
Thank you, Mr. Chairman. Mrs. Shurak Irwin, thank you for being here this morning. So you did mention that there is a nationwide blood shortage, and so maybe help me understand, would it be or could it be a net positive for people who wanted to donate and store blood for themselves? Couldn't that help alleviate any potential drain on the rest of the supply for the rest of the nation?
Mr. Irwin.
It diverts our people from doing this, right? We have to pull people off of our line and all of our distribution and testing to do these specialized units. So I think it actually adds to the shortage and the amount of time that it would take for this extra special processing.
Representative Beiswinger.
Real quick, Mr. Chairman, I'm just curious. I've heard people talk in the past about blood and this whole system. Does blood get shipped out of state? Does it stay here? How does that work?
Yeah.
Mr. Irwin.
So blood goes out of state, it goes regionally, it goes nationally. We supply to other states. We are an exporting state region. We collect a lot of blood here. Idahoans are really, really generous, 93,000 units a year. And then if you donate using the app, it will tell you where your donation went. So you can see if it went to an Idaho hospital or to Utah hospital, but it definitely is a very precious commodity that needs to be moved around as needed.